Good evening, Berkeley. I'm Berkeley Mayor Jesse Edeging, and thank you for joining us for this virtual town hall on the City of Berkeley's response to the COVID-19 pandemic. And it's been about a month since our last town hall meeting, and given the news several weeks ago of the spread of a new variant, the Omicron variant, and many questions that we've received from the Berkeley public around this new variant and its potential impact, we thought it was important to reconvene and to provide updates on Berkeley's efforts to address the pandemic, including new updates. In fact, today we learned the state has issued new guidance around masking indoors, which I'm sure Dr. Hernandez can elaborate on during her comments. And so we are monitoring this new variant very closely. We are sadly seeing an increase in cases in Berkeley, as we were certainly expecting, given the holiday season. And I expect that there was an increase in cases after Thanksgiving. In fact, that's what we saw statewide. I think COVID case rates statewide jumped 47% since Thanksgiving. That's 9.6 cases per 100,000 people per day. And so we are definitely seeing an increase. And as we're entering the holiday season and people are gathering to celebrate the holidays, it's really critical that we continue to follow critical public health guidelines to make sure that we can control the spread of COVID-19, particularly given highly contagious variants. But I think one bright side to all of our efforts is the very high vaccination rate that we're seeing in Berkeley, which according to the city's COVID dashboard is 91% of all residents are fully vaccinated, with 34% having received a booster dose. And obviously we want to get everyone to get a booster dose who is eligible. But those numbers are really incredible, and I think are a testament not just to our community's belief in science and commitment to helping collectively address this global pandemic, but the work of our staff who've been working around the clock since the first cases of COVID-19 spread in Alameda County in March of 2020. So, as we're coming to a close on year 2 of COVID, I think it's important to reflect on where we are and where we've come, and just really amazed, despite all the challenges that all of us have endured, whether business owners, residents, government, nurses, doctors, essential workers. The fact that our community has really rallied to respond, and that we really thought and prioritized the health and wellness and safety of each other has gotten us through this really dark point. And by continuing to be vigilant, we can see the corner. And so with those introductory comments, I want to thank Dr. Lisa Hernandez, the City of Berkeley's Public Health Officer, for joining us tonight, and our City Manager, Dia Williams-Ridley. And to kick things off, Dr. Hernandez, I want to turn it over to you to provide us an update on our case rates in Berkeley and any recent public health orders and information you'd like to share with the Berkeley community tonight.
Good evening, Mayor. Good evening, City of Berkeley. Just want to wish everyone happy holidays. If I forget to tell you that at the end, we are in holiday season, and I do want to wish everyone well. As the mayor said, we are seeing an increase of cases, and I wanted to give you an update on our numbers. Both, as usual, I'll start with Alameda County and then focus in on the City of Berkeley with our data, and then I'll talk about some of the issues as the mayor outlined in terms of orders from the state and any other changes that we see coming. So in terms of Alameda County, Alameda now has 118,825 cases of COVID-19, with currently 61 individuals hospitalized and 15 individuals in intensive care unit. Their deaths are at 1,463 confirmed deaths due to COVID. They are looking at their test positivity at being 1.3%, and their case rate unadjusted at 6.4 cases per 100,000 per day. They also report their vaccination status as we do. Their vaccination percent vaccinated in the total population is 77.7% of the total population of the County of Alameda, which includes, of course, City of Berkeley, is fully vaccinated. For individuals that are 5 to 11 years of age, 25% of 5 to 11-year-olds are fully vaccinated in the county as a whole. When we look specifically at city data, our cases, we're now at 5,438 cases of COVID-19, and we're averaging about 13 cases per day. And I'll talk about our case rate in a second, but we're seeing an increase in our cases. Even we've been seeing a sustained high level of cases, and now we're seeing them increasing even more so since the holidays. Hospitalizations, total 155 people have been hospitalized that are City of Berkeley residents. No one is fortunately hospitalized. I would say that hospitalizations and our death counts have been relatively stable, which is excellent. Our death count remains at 55. That has been the same since September 1st. That's when our last death was reported in a City of Berkeley resident. So that's encouraging news. I worry with these surges if we'll start seeing those changes, because if we're seeing more cases, we may see more severe disease and death, especially with the advent of the Omicron variant, which we're still learning about. In terms of testing, demand still remains high. We had a little dip during the holidays because I think people were not testing, but we're seeing about 1,600 tests per day. That's our 7-day average, and that's sufficient, and that's an adequate testing volume, and that is due to the availability of tests that we have in our providers. Our providers are testing, our pharmacies are testing, we have our testing supports, but that is available. Testing is available in so many different places, and our volume is adequate. When we look at our case rate, as I mentioned, it has increased. We're now at 11.5 cases per 100,000 per day, and that case rate puts us in the substantial range for transmission when it comes to the CDC's metric. And our test positivity is at 0.78%. That's seems low, but we're actually seeing an increase in that test positivity over the last few weeks as well. Other increases which are positive would be our vaccination status, where, as the mayor announced earlier, 91% of our population is fully vaccinated, which is excellent news. And I appreciate the community for coming out and getting vaccinated. In terms of the 5 to 11-year-olds, 53% of the 5 to 11-year-olds in our city are fully vaccinated. That's excellent, and we expect to see that number rise as of 71% of 5 to 11-year-olds have received their first dose. So we will start seeing those numbers increase over time. In terms of booster, 34% of those that are fully vaccinated that are City of Berkeley residents are boosted. So that's also, these numbers, I would say, are one of the best. They're the best I would say, in the region. I would hazard to say that our numbers rival any jurisdiction in the state and nation. So I just want to thank the community for participating in vaccination, because vaccination and boosting is really going to be one of our keys to keeping us safe. As the mayor mentioned, there were actually 3 updates released from the state this afternoon. One was masking guidance. And all 3 of these guidances and requirements become effective on the 15th. So masking guidance, CDPH, California Department of Public Health, is requiring that masks be worn in all indoor public settings, irrespective of vaccine status, from December 15th through January 15th. And they are recommending, if you can, to use a surgical mask if you have it, especially in settings where you're in mixed company, I would say, where you are not aware of what people's vaccination status is. And the question might be, what does that mean for us in the city of Berkeley? Because we do have exemptions to that, to our own mandate that we have for masking in certain settings where if you're fully vaccinated, you can remove your mask in gyms or in office settings. The state is more restrictive, so we must adhere to the state at this point. So we'll be updating and providing guidance in the next few days to provide some more clarification. And the state is also going to provide more clarification on some of their guidance and requirements, but wanted to alert individuals of that now. Other updates from the state were mega events. Those are the events that are indoors, 1,000 or more attendees, or outdoors, 10,000 or more. For those settings, mega events, the requirement hasn't changed for vaccine. It's either vaccine or show testing. But if you're testing, if you cannot provide proof of full vaccination, the state is now requiring that there is a proof of a negative COVID test, either 1 day if you're using the antigen test, or 2 days if you're using a PCR test prior to entry to those events. And again, that is effective on the 15th of December. So if you're happening to go to a mega event today, you still have that, I think it was 72 hours prior to entry that you had to show your testing. So now it's been shortened in terms of the time interval. The last guidance that was released by the state is in terms of travel. And these are the recommendations that they're making, that all travelers arriving in or returning to California from other states or countries. So it doesn't matter if it's domestic or international travel, you need to follow the CDC travel guidance. And basically what that says, and I was going to talk a little bit, I will talk more about that in terms of travel in a second, but no travel if you're sick or if you've been exposed to someone with COVID-19, delay travel until you're fully vaccinated. Of course, the recommendations, the requirements actually for places of transport like airports, you have to wear masks on airplanes or in airports or in bus stations. Those are things that the state is requiring of all travelers coming in and out of California. And then all travelers arriving or returning to California from other states or countries should test 3 to 5 days upon arrival. So after you've gotten to California, no matter where you're coming from, the recommendation is for testing. And of course, the last part of their recommendation is that all travelers who test positive or develop symptoms should isolate and not expose others to COVID. So those are the newest recommendations and requirements from the state. I'll talk quickly about Omicron. It is definitely a variant that we're watching. It was first reported by the WHO, World Health Organization, in November, at the end of November, November 24th, that this variant was detected. It was recovered from samples that were collected in mid-November. November 11th in Africa, and Botswana was the first specimen. And on the 26th of November, the World Health Organization named the variant Omicron and classified it as a variant of concern. CDC followed on the 30th of November and designated it a variant of concern for the United States. We identified the first Omicron variant in San Francisco, the first variant in the United States in San Francisco on the 1st of December. And And as you know, we announced a case in Berkeley that was affiliated with a outbreak of a wedding that was held in Wisconsin, and our resident and 12 other residents, 11 other residents from Alameda County also had COVID from that wedding. Our resident was had their sequencing result in Omicron, and as well as 5 others. So we know that we have Omicron detected in our Bay Area. These are the ones detected. We know that there's more variants that haven't, Omicron variants that haven't been detected yet. As of now, at least 28 states have detected Omicron, at least 18 cases in California, and I mentioned the ones in Alameda and Berkeley. And we are doing sequencing. If there are specimens that are going through the IGI lab through Berkeley, UC Berkeley, 100% of the positive tests are being sequenced. And for state labs, it's anywhere from 14 to 23% are sequenced. So we're trying to increase that sequencing, and just wanted to give you that update as of right now. That's what we're seeing in terms of sequencing. Despite the reports of Omicron, we're still seeing Delta as the main variant circulating in the United States at this point. Will that change? I think it's likely that we'll see more. We will see more Omicron, and I feel that it may, if it's behaving like we're seeing in Europe and abroad, that we will see Omicron being one of the more dominant variants and overcome Delta in some time. We're also, as some of you may have noted in some of the articles in the news media, that we are sequencing wastewater. That's something that has been done throughout the pandemic, and wastewater sequencing is being performed here in the city of Berkeley, and it is a lead way for us to see if we're detecting any variant or COVID in general in our community. So that's something I just wanted to make sure people were aware of, the fact that we are also performing that here. My recommendation right now is we have to continue using the layers of protection that we know work best. I have to urge everyone to get boosted if you haven't been boosted. While we do have great numbers for fully vaccinated, and about 1/3 of our population is boosted, that's fully vaccinated, we still need to see those numbers go up, because we feel 2 doses of vaccine is not enough, or 1 dose if you got the Janssen. So I urge individuals to get boosted, and masking, and then testing. Those are the 3 big layers of protection that I would say we need to continue to use. Just a couple other updates. BUSD, Berkeley Unified School District, that while they're going out on break at the end of the week, I'm sure all the kids are happy to have that break. When the students and the staff return, all middle school and high school students and staff need to be fully vaccinated against COVID-19 starting on January 3rd. If they are not vaccinated, then they must test weekly, and that's going to be performed on site, provided on site. So I just wanted to let you know that's what the schools are requiring. And just going on to holiday travel. While I know holiday travel is important, I look forward to having my son, who's away, come back to join us as a family. I know that others are looking forward to having family come together and celebrating the tradition of the holidays. And there are certain things that we need to remember to keep ourselves and others, especially those that are not eligible yet for getting vaccine, protected. So one is get vaccinated, get boosted. And now we know that in public settings, there's a requirement in the state for masking. And I would say that you should also consider wearing a mask indoors, especially in settings where you will have individuals who are not vaccinated or can't be vaccinated, or who are vaccinated and are immunocompromised, because we know that even those that are fully vaccinated that may have a their immune system not fully competent may not have the full benefit of a vaccine response and protection. So that's one thing I would recommend. Make sure that you have best ventilated areas as possible, and test. As the state has mentioned, testing 3 to 5 days upon returning from travel. If you're having holiday gatherings, I would encourage testing prior to the gathering, and then testing 3 to 5 days post gathering. This way you can protect yourselves as much as possible. Other thing, wash your hands. Wash your hands. You have to continue to wash your hands. That'll help with COVID, as well as any other infections, even foodborne diseases. And also stay home if you're sick. That's a big one. I know this is the hardest time to be away from others because of the holidays, but if you're sick, please stay home. Last thing in terms of travel is international travel. CDC on the 6th of December made a requirement for all air passengers 2 years and older, regardless of vaccination status. They must show a negative COVID-19 test no more than 1 day before travel from a foreign country upon return, before return to the United States. And you will have to show your negative result to the airline before you board your flight. So that is something that I want to remind people, individuals, if they're traveling internationally, that they must prepare for upon their return into the United States. If you've recently recovered from COVID-19, you may instead travel with documentation of recovery from COVID-19. You could have, and that's recovery within the last COVID and recovery within the last 90 days. And you would check with your airline, but essentially a letter from your a licensed healthcare provider should be sufficient with your testing documentation. But I would again check with your airline to see what kind of paperwork you need, so plan ahead. I will stop there, Mr. Mayor, and hand it back to you. I'm sure there's a number of questions that might further provide information for the community.
Thank you so much, Dr. Hernandez. You actually addressed some of the issues that were that people had asked about in their questions, but we'll go to people's questions, and thank everyone for submitting your questions tonight. I want to go now to our city manager, City Manager. Good evening, and wondering if you can provide us an update on city operations and our city administration's response to COVID-19.
Thank you so much, Mr. Mayor, and happy holidays to all of the callers that are listening in, and thank you for holding this again this evening. So what I'd like to do is just give 2 updates. One will be on our vaccine mandate for the employees in the workforce of the city. Our city employees a number of them have been on the ground working since day 1, and then others, of course, are working in office space as well as from home. So we did institute a mandate for vaccine status here with the City of Berkeley. So I do want to give a quick update on that. And then second, I'd like to give an update on the work that we've been doing around our unhoused. And I think it's really important to share some stats and details around what we're doing around our unhoused community and how we're trying to help and support them. So first, let me just share a little bit about where we are with our vaccine mandate for employees. So we currently have a total of about 1,330 employees in the city, and these are full-time equivalent employees. Of those employees, 1,244 are vaccinated. That's representing a 94% vaccination rate in our city, and it is commendable. We have about 62 employees of that number that are unvaccinated that are requesting for accommodation. And as many of you know, accommodation can be both for medical or religious. Medical is pretty cut and dry. We're able to review those, and we have provided accommodations for at least 3 employees around the medical requests. However, religious exemption requires further criteria and review. So we are still underway reviewing that criteria and determining eligibility. But as of today, employees that are asking for exemption that have not received a response from the city yet in terms of whether or not their exemptions will be accepted, they are required to test on a weekly basis. So for now, I think we're doing a great job in vaccinating our employees and making sure that all of them are vaccinated. One of the other things that we did sometime in June was, I think it was early June, we did start bringing employees back into the office. For one piece was to ensure that we were providing, great customer service to the community. I wanted to make sure that our community was served well and that our doors were open. So we reopened our doors early this fall. I think it was in August. I can't remember the dates exactly, Mr. Mayor, but we did open our doors full-time, open to the public to receive services from our city. And so we've had our doors open for quite some time now. So people are able to come in and to visit and come into City Hall to gain access to services. So that's it on the vaccine mandate for employees. I didn't see any questions in the queue about that, but I did want to provide an update on it. And then secondly, I'd like to just share a little bit about some of the really difficult work that we're doing out there around our homeless response. As you know, and some of the callers on tonight may know that I'm scheduled to provide updates to our council and the community at each council meeting. So tomorrow evening will be the first actual report where I'm providing specific data around certain areas. So I want to share a little bit about that and what will be reported and give some stats this evening. So in July, Council adopted the All Home Regional Action Plan, which commits the City of Berkeley to a 75% reduction in unsheltered homelessness over the next 3 years. The homeless response team that we've established here in the city is a team of city staff that are first point of contact when making that vision a reality. So how are we going to measure the impact? We're holding ourselves to 3 outcomes that we wish to achieve. The first and most important of these outcomes is that our residents are sheltered. We will measure the progress towards this outcome by reporting back to the council and community on the shelter acceptance rates from our outreach efforts, as well as the housing outcomes and housing resources that we're able to connect people with. I do not have data on housing outcomes this evening, but we are working on this for future report outs for the council. I will share some other stats though. The second outcome is that dangerous encampments dangerous encampments that are not inevitable in our city. Even if people living in encampments are not interested in the sheltered resources we have at our disposal, there are certain health and safety threats like needles, vector hazards, fire safety concerns that must be mitigated, both for the health of the encampment resident themselves as well as the greater community. So these are just some examples of the types of health and safety reasons for which our housing response team will decide to close an encampment, for example. So we'll measure this outcome by tracking the number of notices also that we provide, as well as the number of closures that we perform. Finally, the third outcome is that our city is clean. Even if an encampment doesn't need to be resolved, people living in unsheltered areas often have no place to throw away trash. We also know that homeless encampments can become magnets for illegal dumping. So we're tracking this outcome by measuring the total pounds of debris that we remove when we were out there working with our unhoused population, as well as the number of instances where storage for valuable belongings is provided. So with some of those limitations in mind, every one of the encampment sites that we've tracked since September of 2021 We have received shelter offers. All of them have received shelter offers. And nearly every time we visit an encampment, about 97% of the time, at least one shelter offer is made. The lone exception in all of this is where we visited small encampments where no one's home, but we posted a notice of closure. We have also recorded a total of 113 shelter offers made to date and 56 safe RV parking offers made to date. 31% of our shelter offers and 25% of safe parking offers, they have been accepted. We also note that this rate can drop by nearly half, like to 16% on encampment closure days. So we'll continue to track this to see what we can learn from it, but that rate is a rate that we definitely want to increase. Our second outcome is around dangerous encampments. Our team's regularly on the streets. We're providing notices for violation of our sidewalks, our street medians, and park rules. And the purpose of these notices is to give our encampment residents the opportunity to voluntarily comply with the rules. So far, we can report on that 54 tents and structures that have been given a notice of some kind. Most of these have been formal closure notice. 75% of them have been formal closure notices. This is because the team only started recording the provision of other notices such as sidewalk or park rule notices. We started that in late November. So this data will be rounded out as we move forward. So to date, we've had a total of 10 encampment closures since September, and more probably going on this week. Our third outcome of interest is ensuring that our city is clean. And in terms of stats for a clean city, this has been going on long before the city resumed enforcement of sidewalk and park rules in August of this year. Our neighborhood services and our Clean City team from Public Works have collaborated to regularly visit our encampment sites. And this happens usually twice a week to just remove debris, just garbage. And since September of 2020, 1 year before the launch of our homeless resource response team, our team removed over 495,580 total pounds of trash and debris from our city streets. So our homeless response team is working very hard, not only to provide outreach services, but to help keep our city clean and to provide resources for shelter. So those are my updates this evening, Mr. Mayor, and I just want to thank you for the opportunity to share some of those details with our community.
Thank you so very much. So we'll now turn to the questions that we received tonight. And I want to first direct these first three questions to the city manager as they relate to city operations. So this first question, I think, is an important one, which is whether the city is providing any added support for our public health officer, department, or medical community that have been dealing with the pandemic for the last 2 years. Specifically, are there additional mental health resources available for our public health staff and first responders?
Thank you, Mr. Mayor. And yes, the answer to that question is yes. We have provided support to not only our mental health staff, but also our public health staff. And Dr. Hernandez can speak to this a little bit more, but we have looked at every area of our COVID response to determine what the needs are. Whether there are needs for testing, whether there are needs for, early on, it was for screening and reviewing and contact tracing, right? So we needed a lot of support for that. I don't think we can ever have enough, being that we're our own city managing this crisis, unlike a major county that has multiple folks that are out there to address these concerns. But we certainly have increased our staffing for our mental health and public health teams, as well as look throughout the organization to provide support from other departments, especially as we've moved through this pandemic. We are still in an emergency response here in the city. So our EOC, Emergency Operations Center, is still activated. And at any time, our employees are disaster service workers, and they can be deployed to support operations of our crisis response. We've tried to pull back a little bit because what's happening is that we're moving right back into the full mode of work. So it's, it's hands all in right now in trying to lift up some of the work for our municipality that's been on hold for probably over a year and a half. And so it's taking some of our teams from the EOC response and moving them back into their day-to-day operational needs. But we certainly are very respectful of the needs of our public health team and our mental health team. They have an open door to me, of course, to determine if there is something that they need, that they can certainly rely on me and our leadership team and Dr. Hernandez and others to make sure that we do the work to get them what they need. So yes, we are managing and supporting our mental health team and our public health staff. I think they could always use more.
Certainly. Well, thank you so very much. I'll turn to the next question, which is not COVID related, but it is it's a question I have because I go by this place, multiple times a week. This resident's asking when the North Berkeley Senior Center will be open. It looks like they're almost done with the work.
Yeah, well, our community has been so patient. This is 6 years, Mr. Mayor. I don't know if you remember when we closed the center down and start, deferring our senior community to the South Berkeley and West Berkeley sites. And it's been a long time, but I do want to share tonight, this evening, with our community that we've had a number of problems, a number of setbacks. But the good news is that we're looking at opening in March. We are hopeful that in March of 2022, we will be opening up the North Berkeley Senior Center. And we're very excited about that. But I do want to point out some of the issues and challenges that we've experienced. So we've had a number of contractual issues with our contractors. We're still working with them very closely. Some of those have been around compliance issues as it relates to the COVID pandemic and ensuring that they are being responsible and responsive to the actual restrictions that we are requiring of our contractors. So we've had to do a lot of work with them to make sure that they are complying with our rules. We've also had some flooding. If you recall the last rain that we had, we did get some flooding at the senior center. So it's put in a little bit of a setback. And then lastly, change orders. We are scrutinizing every single change order that comes about, and it has created some issues. So we are working with both our legal staff as well as contractors' legal staff to make sure that we're fiscally responsible for the resources that council and the community have provided for this work at our senior center. So we're going to continue to be very vigilant about that. And we are excited that March will be the opening, and my fingers are crossed still that we can get through some of the issues that are still outstanding. But March is the date right now. I do encourage folks that are interested in the yoga classes and the other senior services for family members that need support for healthcare issues, that they frequent or utilize our South Berkeley location. As you know, the West Berkeley Center is now a service center. So the services for recreational services and health services are available at the South Berkeley Center. Thank you.
Thank you very much. So we received a number of questions regarding booster shots, testing, various health orders and requirements. And so I want to turn to Dr. Hernandez. First question is around booster shots. This individual had to travel to West Contra Costa County as they were unable to get a booster appointment in Berkeley or Oakland. I had to go to San Francisco. I'll just note for the record, because there were not available appointments at any of the sites or any of the pharmacies. And I know that some of the vaccine was being appropriated for kids 5 through 11. And then there's been a huge demand for booster shots, particularly since Omicron started, was announced and first cases were confirmed. So the question is, are there any plans for the city to provide a mass vaccination site to increase the number of booster shots?
Not in the way that you remember from a year ago when we were doing essentially 1,500 doses a day at almost 2,000 doses a day at the site at Buchanan Street. So we're not going to open another Buchanan Street mass vaccination site. And a lot of that has to do with the fact that now there's multiple places to get vaccine. I have my booster appointment Friday, and it took me over 2.5 weeks to get my appointment, and it's at a site that is some distance away from my house. That said, what we heard from the community in terms of vaccination ability or access here in the city, we ended up opening additional sites. Our booster or our clinics in general are open to usually 5 and older or 12 and older, depending on what vaccine is available. While the Pfizer vaccine is the same type of vaccine, the dose is different for children than it is for adults. So we're not competing for the exact vaccine for most, like for the first series for the 5 to 11-year-olds in particular. But what we are competing with is staff. So it's a matter of having the capacity and having the staffing to do it. That said, we do have a multiple amounts of clinics that we've opened up. And in fact, tomorrow there's a clinic at Berkeley City College, which is downtown. That is located at 2050 Center Street. And that is Tuesday tomorrow, and also the 21st. And tomorrow's clinic, I checked at 4 o'clock today, and as of 4 o'clock today, there were still 79 appointments available for that clinic. And that is for 5-year-olds and older. And it could be first dose, second dose, booster. So while maybe when those individuals like myself look for a booster appointment, the appointments were farther out or in other locations that weren't within your city jurisdiction, that's what we have right now, is that we heard the need and we opened up additional vaccination slots with our provider. So that's for Tuesday, tomorrow, the 14th. And then there's another clinic on Saturday, the 18th at South Berkeley, our South Berkeley clinic, which is at Sylvia Mendez Elementary, which is at 2840 Ellsworth Street. And that clinic has, again, as of 4 o'clock today, so that's probably a little less now, but there were 60 appointments available. And that again is for 5+, so that's Pfizer. And that's going to be for first, second, and booster doses, so that's available. So I would say while we're not having the mass vax that we saw a year ago, we are having availability, and I can speak specifically to the city-run sites, and we're not the only game in town. You got to look for your provider, ask your provider if they don't have it. I would message your provider to ask, because I think that we're relying on these other avenues when we know that our providers also are a player. Kaiser has been a really great partner with Vaccination. So they, I would say if you're a Kaiser member or a Sutter member or John Muir, those are the 3 big healthcare providers within our jurisdiction. I would ask your provider. Also going on My Turn and looking at those sites. But I just wanted to highlight that we do have availability for boosters. As of 4 o'clock today, we had 139 appointments in the next week, which isn't a super amount of appointments, but it shows you that even in a clinic a day from now, less than 24 hours from now, has appointments.
Thank you so much. So encourage you to go to cityofberkeley.info/COVID-19 for information about those clinics. And I think people need to sign up through Carbon Health to make an appointment, but there are spaces available. So if you're tuning in and you want to get your booster dose, highly recommend that you go to the city website right now. Second question around boosters, particularly around prioritizing seniors. I know that initially the boosters were prioritized for certain populations. Now they're available for everyone, who is eligible. And so, I think that was probably the initial focus of the rationing of boosters initially, but given the spike in cases that we're seeing and, a new variant, I think we're just encouraging everyone to get a booster if they can. We're not limiting it to seniors or people with compromised immune systems. Is that correct?
Yes.
So it is extremely important that seniors and people who do have compromised immune systems get a booster dose. But also everyone, frankly, should get a booster dose if you're over, I think
16.
16, yeah. So, but particularly those people who are at greater risk, I think it's extremely important. That's, I think, part of the reason why we have particularly had these clinics, because we want to make sure that that residents in Berkeley who have not been able to get an appointment, that at least there are some opportunities for people to get a booster appointment. So sign up if you haven't.
And I do want to add some more to that, just a little bit. I think another part of that question was like, how are we doing for those individuals that are age 65 and older in terms of our booster? So the number, which is not presented, we don't break down age for our booster data on the public website, but we of course track this. 73% of people who are fully vaccinated that are age 65 and older have received their booster. So that's 73 versus the 34% of all those that are fully vaccinated that have received a booster. So that's a good number. That said, as you mentioned, Mr. Mayor, the older population is most vulnerable for having complications. That's bottom line, and another reason why they need to get boosted. And we are working specifically to encourage primary series of vaccine if individuals haven't gotten it, and then of course the boosting. And we actually have a specific group that works on that work for older individuals in our emergency operations center, and we've been planning and working to do more work with that. First is making sure that our skilled nursing facilities are actually boosting their residents and staff, and if they don't have the capacity, providing support. So actually our Med Health branch, which is also part of the Emergency Operations Center, is going tomorrow to one of our skilled nursing facilities to do vaccination with them. So we are focusing on individuals in skilled nursing facilities. That same team has already done homebound vaccination clinics. I don't know if people remember, we did initial series for those that were homebound seniors. So we're returning to do boosters. They started they had some clinics last week. We're going to do 2 more in the next coming week. So that's one thing I want to mention. And we are also working with senior apartment complexes. So our low income senior apartment complexes, we're doing clinics. We started last week, and we're continuing until the end of the month doing boosters and as well as first and second doses in those settings. So we are working, focusing our work, as I say, using a surgical approach to doing some more focused work. We have those other clinics, and then we are going on site to people's homes with the homebound, to skilled nursing facilities if they need it, as well as the apartment complexes. So I just wanted to highlight that as well, that while we do have a strong booster vaccination rate for individuals 75 and older, we know that there's more work to be done, and we're doing the work as we move along during this month.
Thank you so very much. Really great to hear about all the sort of proactive outreach and work that we're doing. There was a question around whether we're expanding testing due to Omicron. I know that we had a lot of testing at one point, and then we kind of scaled it back, and then we brought the testing back. So I don't know whether we've seen an increase in appointments for COVID testing since the variant was announced. I know that when Delta first hit, we definitely saw an increase in testing. But certainly, I'm sure we can expect that we're going to see a huge demand for testing as the Christmas season, holiday season approaches.
Yeah. And so we have our own sites that we have always had, one at the Berkeley Adult School, the Curative as a testing provider, and then the West Berkeley Service Center. And the West Berkeley Service Center has hours from Monday through Friday from 8 a.m. to 8 p.m. And then the Berkeley Adult School is Monday through Sunday from 8 a.m. to 4 p.m. So we have those. We're not planning to expand those hours. And what I have even today in conversations with the state, asked the state to not to remove any, because the West Berkeley site is a state site supported by them and jointly with the City of Berkeley. So we worry that, in some places testing is going down. I want to make sure that we continue to have that capacity. There is also more opportunities for testing, not only with providers, but also in pharmacies. There's over-the-counter tests, the antigen tests, which is they're a blessing and a curse. One, they're a blessing because you can know right away whether you have COVID and hopefully isolate yourself. The challenge is that those are not reportable to us. So that's something we won't be able to have that information. I think the state is looking to have a system where we can get some of that information and the general public can report those through electronic means, but we haven't seen any details on that. But I think we're at a different place in terms of testing, and hopefully it's adequate. Of course, if we hear otherwise, we definitely will advocate for more testing.
Thank you so very much. Question around recommendations for gatherings during the holiday season. Are there any specific recommendations that you have or public health office officials have? How many people are allowed in indoor spaces? Can people have potlucks?
There are going to be no specific like numbers that you would have. I think it's mostly going to be as if you can stay distanced, even though that's not a requirement for distancing anymore. I would say that we know what are like features of safer environments. One is good ventilation. Judging from today's weather, it would be hard to think that people would be outside having a holiday meal. But if the weather looks different during those celebrations, I would consider that. But opening windows, so increasing that there's ventilation. One is a second would be, I would recommend testing, as I mentioned before, in terms of making sure that people are tested prior to gathering, and then 3 to 5 days after testing after that event. And making sure that everyone who's vaccinated gets vaccinated, encouraging people to vaccinate. And especially when there's people who are immunocompromised or not eligible to get vaccinated are present to consider wearing masks, especially if they're not present. If you're going home to someone who is immunocompromised, that would be another thing. So there's no number that I would say, but I would say that any of those features, if you could encourage any of those features at your holiday celebrations, I would. As I mentioned, I have a son coming home. I've got a test waiting for him.
Thank you so much. Couple of kind of questions that are lumped together. One is, are any health orders being updated in response to Omicron? And two, will masking rules be strengthened? I guess this gets to what we talked about at the beginning.
Yeah, so we'll have to update our orders, or I'm working with the city attorney to see, as a rule, whenever there is a more restrictive requirement mandate by the state or CDC, those supersede ours. So we may not update our orders because we're already been automatically superseded because the state has imposed stricter orders for those specific settings that we were allowing people to be unmasked if they were fully vaccinated. So as it stands now, that's one thing that we know. And in terms of other requirements, right now, we are not going to change any more orders or requirements as it stands. Again, we're still in that learning phase of COVID. Again, I recommend that people get boosted if you're not boosted. The definition for fully vaccinated still remains 2 doses if you have a 2-dose series and 2 weeks after that, or the 2 weeks after your dose of Janssen. Waiting for the feds to change that. I do predict them changing it in time, but we only have 1/3 of our population boosted that's fully vaccinated, and we're doing well. So I don't think that the rest of the nation is there yet. And I think it'll take a little time before they do. The federal government makes that a requirement, but I do see that coming. But I don't, right now, we're still in a watch and wait stage with the adding any additional requirements beyond what the state issued today.
Related to that, and you kind of just briefly touched on this in your comments, is there consideration of expanding the definition of what fully vaccinated means to incorporate mandated booster shots?
I'm not privy to the federal discussions, but I do believe, and I believe Dr. Fauci mentioned it's not if, it's when.
Yeah. So
my prediction is that it will happen in the early part of next year, so 2022. I can't say when, but that's my prediction. I think it makes sense, especially what we're seeing with the behavior of Omicron, that fully vaccinated will require those 3 doses, because we know that 2 doses if you're with a 2-dose vaccine, or 1 dose if you have Janssen, is not sufficient at this time. And we're seeing increases in cases without having an appreciable amount of Omicron in our community. So.
Okay. So probably, in the near future. So it's all the more important why people should get their booster dose, as that may be something that may be required at some point in the coming months. Variants. This question asks, how does the city get data about the presence of variants? What role does public health have in encouraging more frequent sequencing or surveillance of the virus?
So I almost made a comment earlier when I talked about advocating at the state level for the city of Berkeley in terms of testing capacity. I like to advocate for the city of Berkeley. Of course, it's my job too, but I know this question came up earlier, and I promised the person who emailed about that that I would advocate at the state level, and I did just that, that we continue to increase the capacity of testing. As I mentioned in my report earlier, about 25%, 23% of the positive specimens get sequenced at the state labs, and I asked for them to do more. If we see something happening in Berkeley, we absolutely can prioritize our test to get sequenced first. And we have a number of, and this is for any jurisdiction, but we have something that's a little unique here in Berkeley because of UC Berkeley. But first, it depends on where the specimen came from. We would either use the lab that the specimen was collected, or we could work with the state to have them sequence that specimen or specimens, or we work with UC Berkeley in the IGI lab. So they sequence 100% of their specimens that are positive. And if we have specimens of concern, we could also ask IGI to help us if that's going to be a quicker turnaround for us. So that's one thing. And how we get sequencing results just in general, let's say like what happened with this case, our first case in the city, that subset of 25% of the positives that get sequenced, we get those reports back to us, and then they're reported to us from the state. Or all labs are required to report to either ourselves directly, the city directly, or to the state. So we have different mechanisms to get that information.
Okay, thank you so very much. Looks like we have a question in the chat that this resident, their work requires that they have to upload their Binex test results. I think the state of California does. So, so it sounds like some employers are requiring surveillance testing on a weekly basis, and that you have to upload those results. That's actually very interesting.
Well, it'd be great if they expanded it to, and that's some talk at the state health department level. Maybe we'll hear about it. We meet with the state, have scheduled scheduled meetings with the state. We meaning health jurisdictions every Wednesday. Mm-hmm. So maybe we'll hear about it tomorrow. I know there's been talk about it. Other states have done it. So I think it's just a matter of what the capacity is. And it sounds like that's already happening at the state level. So that's great to hear.
Thank you.
Yeah, I was just gonna say, and it's great that it's also the antigen test as well.
Thank you so much. So we did receive a question, not specifically related to COVID-19, but the impact of COVID-19. This resident would like to know how they can apply directly for housing emergency assistance. And there's two opportunities. One, the City of Berkeley has a housing retention program, which provides one-time grants for people who are behind on their rent, and individuals who are eligible can receive up to $10,000 for rent payments. We encourage people to contact the Eviction Defense Center, who is administering that program. And their number is area code 510-452-4541. Once again, that's 510-452-4541. In addition, we know that there's a state ERAP program. And we encourage people, the money is actually being administered through nonprofits, through the county. And so individuals that are interested in applying for the ERAP program, go to www.ac/housingsecure.org, ac/housingsecure.org, or call 833-430-2122. I know that, as we all know, it's been widely reported that there's been challenges in terms of getting the ERAP money out the door, but Berkeley has its own program that's very similar. where we put several $1 million into that, although there's been a huge demand for the resources. And so, if you have been unsuccessful in getting ERAP money, there's also the Housing Retention Program through the Eviction Defense Center. So thank you very much. So those were all the questions that we received tonight. And I just want to thank everyone for tuning in. Thank residents who submitted very thoughtful questions. And just say in closing, before we close, I want to wish everyone a very happy holidays. We encourage everyone to celebrate the holidays safely. We do encourage everyone, if you can, to get a booster appointment. There are appointments available through clinics as we advertise today. Go to the City of Berkeley COVID-19 website, cityofberkeley.info/COVID-19 to sign up. And also you go to myturn.ca.gov where there's information around various vaccine clinics, and as well connecting you to various pharmacies that also have vaccine appointments as well. So we encourage everyone to get a booster shot if you are able to. It's going to be really critical, to help slow the spread of this new variant. And just in closing, as we close out 2021, I want to thank the people of Berkeley for your vigilance and your commitment to science and everything you've done to help get us to this point. And to thank the leaders assembled here once again for all their tireless work that you've done to help protect our community over this past year. So I'll turn it over to Dr. Hernandez if you have any closing comments I'd like to share with the Berkeley community.
Sure. Actually, we got a comment from someone from the general public about what could the Berkeley residents do for me. And one of the responses is, it's actually, I agree, is get boosted, but I would say one more thing. Bring a friend or help someone who cannot access the computer or cannot access the vaccine appointment because of challenges with transportation or language barriers. I would say that's something we see, because we see these, while we have great vaccination rates, both for primary series and for now boosters and for our young children, we are still seeing health disparities based on race, ethnicity, and then actually for our older individuals as well. So I would say that's one thing that it's not just you getting the booster, or if you're boosted already, awesome, but help someone else. And that could look like, as I mentioned, helping them get signed up, helping them get to the vaccine appointment, talking to them about the importance of getting boosted. And I'm sure a number of people are like, well, I did my primary series, I'm done. But unfortunately, we need to get that third booster. So I would say that's the one thing that that's my holiday wish, is that we get people boosted that may not have the same ability to get to a vaccine site or are not thinking or ready yet. So having those conversations with your friends and people that you know, love, and trust. So that's my wish. And then I'll end it by saying thank you to the City of Berkeley residents, to my bosses here, Mr. Mayor, Dee, thank you so much for the support to do the difficult public health work that we do. I appreciate that, and I wish everyone a happy holiday and happy new year.
Thank you so much. I want to turn to the city manager to ask if she has any closing comments for the Berkeley community tonight.
Yes, Mr. Mayor, and thank you once again for being so thoughtful around our community and making sure that they're well informed. It's a breath of fresh air to actually be on the screen again to talk with folks. So thank you. And to Dr. Hernandez and the community, and they're well aware, you have been stellar in this work. And I could not have asked for a better leader around our public health needs and just staying the course, even when it got tough and hard and decisions were being made, and folks were looking to you for your advice and your professional decision-making, and you did an outstanding job and continue to do so. So thank you very much for your leadership. I certainly could not have manned this ship without you. So thank you. And to the Berkeley community, this has been a long journey. We are pushing into what, 21 months? It's been a long journey, and folks have just stood up and supported one another and each other. And I applaud Dr. Hernandez's wish for you all to help someone, lift someone up, take them along, and make sure that they can get vaccinated and boosted. I think that is wonderful. And I think that's what we've been doing. I think that's what you all have been doing. And please continue. Finally, I just want to say to our community as well that the employees here in our city, our workforce, they are hard, dedicated, committed workers. And I'm really grateful to all of them for stepping up and stepping into all of the issues and challenges that we faced as we've watched everything change in front of us. There's been so much change, from testing to vaccine to boost to no mask to mask. There's been so much. So everyone has done their part, and let's keep doing it. So thank you so much, Mr. Mayor, and thank you to our residents.
Well, thank you, Madam City Manager, Dr. Hernandez, for joining us tonight and updating the community. I know the Berkeley community really appreciates these town halls and these updates. And with that, once again, we want to wish everyone a very happy holidays. Please get boosted if you haven't, and look forward to seeing everyone in 2022. Have a good evening.